This is the main slide for today. This is the way you find rotations. The first one is the official website. So it comes with a great power like this. First one is the most effective way, then comes the second, third, fourth, fifth, and the sixth one. Agencies goes at the last resort. Okay. The first one is the official website. You go on official website, you check for the requirement. Someone wrote that one of the program asks for the ECFMG certified. How can they go for it? ECFMG certified, you can only be after step two. So try to find some program which is not requiring that, or you may email them that I'm this student, have given my step one or come from this state and so, and want to do rotation with you guys and have not planned step two yet. So can you provide me a rotation? Sometimes they might have some slot empty. Like you see in winters, it's snow and the people not coming over there. So they might go for it. Like it's fine. They're there to teach you. They're there to help you. So if there's a spot available, you might get one. They say that we recommend a person having this certificate or this step, but it's not always must. So official sites for university, community programs, and uh, and the private clinics as well. Okay. So university, I know people doing rotations with UAB, San Diego, John Hopkins, Miami, South Florida, and John Hopkins, Yale, yeah, and community hospital, a lot of them, like St. Mary in Pennsylvania, St. Mary St. Clair in Jersey, Geisinger. I did in Geisinger, which is in Pennsylvania, right center. It's in Pennsylvania. There's one MedStar in Maryland. So there are a couple of them. Go to their website, try to connect with them. The second comes is the personal contact. I believe a lot of people are gonna get rotations from there, and which is very important. Like you can directly connect to your friends and get the LOR at the end. If there's some issue on their side, you can directly connect to them. So personal contacts goes in a friends like your senior, your colleagues, your junior, getting match over there. Ask them if they know someone. They can help to get a rotation over there, or they might know someone because like right now uh, and a lot of my friends, I can ask them that my brother or sister wants to do a rotation. Can your program provides it or not? Second one, if you guys come from a non-medical family, you guys can go for professors. You can ask your med school professors that can you guys help me because their friends, their colleagues might be somewhere. They might help you with it. Even I did had all my rotations, but I did get connected to one of my professor's friend, and he was ready to give me a rotation. So that's one of the other point. Ask them where are they, and this all rotations and LOR like a private clinic, but the person knows you is better than a generic LOR, even if it's a it's a private letterhead. So try to go for a person who knows you and who can write you, who can vouch for you. Sometimes the program knows some guy. They might call them that I see your LOR over here. Do you know this guy? And if you're done specifically with a connection and went there, they might know, like, yeah, I know this and this. I know Mr. Kumar. Yeah, he was there with 2 months with me. So it's very important that way. Then family connections, your parents might be in a medical field or they know someone out there. Um, so try to connect with them. They might help you getting connected to someone else, and you can do rotations. Any person in US, every person in US has a PCP, primary care physician for them. They can ask them that he or she is my brother, sister, or my friend. Can you provide or help him with the rotation? I've seen one of my friend didn't had any connection, but the sister was there. So she asked the primary care physician, "Can you provide my brother rotation?" And he said yes, and he got at the end he got the LOR and he matched at the end. I also know a friend who they had a business, and the next door doctor, next door was a doctor. They did connect and help the student to do a rotation over there. So ask friends, family, anyone who is in US, you can ask and knock their doors. Then comes the cold emailing. You can cold email everyone and like university programs, there are a lot of doctors around there, a lot of physicians. Just email them. They might be, if they are free, they might give you a rotation. Try to include all of your achievements. If you got gold medals in your med school, try to highlight it in your CV or in your emailing that okay, I've done this. If you're given step one and step two, try to highlight it. If you are looking, if you are emailing, cold emailing someone from the gastro department of Mayo Clinic, then, and if you have done some research regarding gastro, try to highlight it. If you have done research with some bigger doctor who is in cardio or who is somewhere who is from Mayo Clinic, you can highlight it over there that I am this given step this and I worked with this doctor and I'm interested in gastro. So I want to do rotation with you. And because of my interests, I did this research, this. They might read the research, they might like it, and they might offer you a rotation. So that's the third thing, how to write email. You can absolutely take help of ChatGPT. It helps you a lot, but try to fill in and don't hide. Like people are shy, they don't want to show their things up. They score to 17 step two. Show it. If you show it, they want everyone wants their student to highlight. If someone, if you talk about me, if there is a student who is 270 and I send it somewhere, I'm gonna be proud that oh that student's doing great over there and their program director is gonna say that okay the guy you recommended is doing great. Thank you. Then comes the conferences. You go to US-based conferences, try to make friends. A lot of physicians come there. They are all academically active. Go them, talk to them, take their emails, take their messages, text them, email them that we met over this, and I want to do a rotation. I'm interested in this. I'm sorry, interested in neurology, interested in psychiatry, and we met over here. So they might know it. Yeah, I know this guy, and they might provide you even 7 days rotation. One professor asked me that okay, so I did a presentation. Try to do a presentation. They might know you with the presentation that okay, this presentation, I know this guy. So a doctor did give me 7 days of rotation over there, and at the end it end up for a month. He did a time for 7 days, and then I went there, and the plan changed, and he gave me a 1 month rotation. So main four things completed: official website, then personal contact is the main thing. Personal contact is the main thing because when you apply, the physician's gonna get so many emails that please upload my letter. He's busy. He's gonna upload everything at the end. But from our side, you're gonna be curious. But if you know someone that you know that he's gonna stand there, he's gonna help you at the end. So the curiosity, the nervousness, and the headaches are less. Cold emailing, as I said, try to write a good email, and you might end up getting conferences. Do a presentation. They might know you, they might remember you, and you might get an rotation. Then comes the LinkedIn and Reddit. It's the social media thing. LinkedIn nowadays, everyone posts all the things online. So you might check on the LinkedIn profile that where they did the rotation. If you see some program over there which gives the visa and which is nearby your area or your family lives by there, you can email them that I want to do a rotation over there, like cold emailing. But cold emailing from LinkedIn is like specific. Uh, you email, you make a list. You know a few students doing rotation over there, your friends there, go to their profile, make a list that, oh, they did this. They already did the rotation over there, so they are giving rotations. Now you email them, they have spots, they can give it to you. Then you can go to the students who already matched, who are PGY1, PGY2. You go to their profile and you see where they did the rotation. You check it, you make the list, and you ask them. They already matched, so the LOR was good. There were less flaws than other things. So you email them, you ask your friend, you ask, so personal contact comes with the PGY 1, 2, and 3 as well. You directly ask them that if their program provides the rotation. If their program provides you a rotation, it's very plus because they will know you doing rotation there. They will know your knowledge and way of working. And when they give you interview, it's not sure. Nothing is surety. But if you get an interview from there, there is someone there out there to vouch for you. They will say that I know this guy from 10 years and you just know it for 1 month, but since 10 years, it's good. So the thing, Reddit, LinkedIn and Reddit goes for reviews. Check the reviews for the rotation. Not every review is perfect because your aspect and my perspective can be different, will be different for sure. If you consider my rotation, one of my rotation, people didn't like it because they used to give us to talk to the front desk, to talk to the patients, like on call. People didn't used to like it that why are we doing the staff work? But I personally liked it because I was nervous at start. My English was not that strong. The accent they speak is a little different, but which made me a little more confident. So the reviews, try to read it, but then go and ask your friend who did a rotation over there. That is it true? How's your experience at the end? And then message them booking. Last thing is the agencies. I would say agency, they're good. They provide you rotation. It's very easy. You get in. But a lot of time things happen is the LORs might be generic. Um, it's not assured, but it happens a lot of times. I did learn a lot from this agency rotations as well, but would say keep it last. If you don't get any rotation at the end, do it because you want at least 4 LORs at the end. The main goal is to match. So go for it. So with the official websites or personal contact or cold emailing, you might find free rotations. With the agencies, it's costly.